Morning, everyone. On behalf of the Venu Institute of Integrative and Lifestyle Medicine, I warmly welcome you to the inaugural session of the weekly wellness series. It gives us immense pleasure to begin this journey with a highly relevant and informative topic, breath, led by Dr. Ashok Bhatt, Senior Consultant at Venu Institute of Integrative and Lifestyle Medicine. Fast-paced world, stress, anxiety, hypertension, diabetes, sleep disorders, and many chronic lifestyle diseases are becoming increasingly common. While modern medicine plays a role in, we also recognize the importance of preventive and holistic approaches that help restore balance to the mind and body. Breathwork is one such powerful practice, physical health, emotional well-being, and inner resilience. At Venu, our vision through the Institute of Integrative and Lifestyle Medicine is to bring together the best of evidence-based healing systems and wellness practices for the benefit of the community. This weekly series is a step in that direction. Through these sessions, we hope to create awareness, encourage healthier lifestyles, and provide practical tools that people can incorporate into their daily lives. I'm confident that today's session will be insightful, enriching, and beneficial for everyone present. I encourage all our participants not only to listen, but also to engage, experience, and carry these learnings forward into their personal and professional lives. Thank you all for being there. Wish this weekly initiative great success. Dr. Ashok Bhatt is a well-known anesthesiologist and breathworks consultant. He bridges the gap between modern medical sciences and ancient yogic practices. He has been practicing breathworks for over 25 years. Over to you, Dr. Bhatt.
I hope all of you can hear me. Namaskaram. Welcome to this session of Breathworks. You are having some physical ailment, any physical, which is causing some amount of pain that directly affects our breath. We may or may not be aware of it. Whenever you are stressed, our breath is directly affected. You go to the doctor for vaccination. Let's say you are going to a doctor for vaccination and you are afraid of injection. Most of us are. The doctor says on seeing you that you are uncomfortable. He always says, just take deep breaths. Take deep breaths. Why deep breaths? Most of us think that that is to take our mind off the pain and focus. No, that is not the reason. By focusing on your breath, by adding awareness to your breath, you charge basic aim. That's the basic science behind breath works. So this comes to a very commonly used term these days, breath works. What is breath works? How it is different from pranayama? And what is swashayam? Well, you just try to remember that we have been breathing for so long now. But have we been able to add awareness onto your breath? We are aware of our breath only when there is some type of difficulty, like say I'm coughing, then or when the oxygen concentration is less inside the body, then you go in for a breath. You become aware. You have to take deeper breath. And unfortunately, most of us are unaware of this very important treasure which has been given to us since birth. Just think of a situation that you have been, when you came back, you were given two blank checks signed by the divinity. And he wanted you to use those checks. And we have these two beautiful treasures which we have been bestowed with. What are these two treasures? Our breath and our sleep. Just by our breath, by taking charge of by managing our charge of our sleep, you can make sure that you have a very, very healthy lifespan. Healthy lifespan is the key. So what is our goal? Health and good lifespan. Yoga is very clear. If we just focus on these two things, then you should be having a healthy life of about 100 years. Yes, 100 years. If you are having any of the ailment, then improper way of breathing and improper sleep, they definitely contribute to the condition of the health we all are having. Of course, aging process will be there. That will make sure that we slow down with age. That's understandable. So just by taking charge of your breath, you can make sure that you remain healthy during all of your lifespan. All of your life. Yes. So our goal is 100 years, healthy lifespan. Tools, breath, and sleep. Take charge of your sleep, take charge of your breath. You will remain healthy for the time you are on this planet. So now we come to what is basically breath works is the connection between the ancient yogic science of pranayama and the modern medicine. That is breath works. And it has got three components. First one is learning the efficient way of breathing. Surprised to know this that 70 to 80% of us we are not using our breath in an optimum or efficient way. I will not say it incorrect way of breathing, but inefficient way. It's just uh, using a lot of power to take care of your house plant. No. So depending upon the power, depending on the take charge, you can use the energy which is at your disposal. So just by focusing on our breathing, first component is efficient way of breathing. Second is adding awareness to the efficient way of breathing. That is breath awareness. And third is with your inhalation and exhalation, depending upon the requirement, depending upon your health condition. What to achieve, what is your final goal. That will help you in taking how to manipulate that inhalation, exhalation. These are the three components of breath work. First one is learning efficient way of breathing. Second is adding awareness to that efficient way of breathing. And third is playing with your inhalation, exhalation, your breath cycle to maximize the efficiency of that breath. So before we embark onto this journey, three universal facts which you must have been aware, may or may not be aware of these universal facts. First one is number of breath cycles you take in a minute decides the number of thoughts which is crossing your mind. So in this modern age, when most of us we have faced this, we are anxious or we are having because of any cause, any external or internal cause, the number of thoughts crossing our mind is phenomenal. Hundreds of thoughts are crossing our mind. We maybe 1, 2, 3, 4, 5, 10 thoughts, but there are hundreds of thoughts which are crossing our mind. So just by decreasing the respiratory rate, by taking less number of breaths in a minute, we can decrease the number of thoughts which are crossing our mind. This is a very important fact. You should remember this always. Number two, the respiratory rate, that is the number of breath cycles you take in a minute, that decides your lifespan. You learn from the nature. If any one of you are having pets, see, their respiratory rate is very high, 40, 60, 80, 100. And look at their lifespan. They live for 10 years, 12 years, 14 years. See the elephants, they live for 75 to 100 years. Their respiratory rate is less. See the tortoise, they take just one breath in a minute or one breath in 1.5 minutes. So they live for 200 years, 300 years, 400. This, I remember a very famous quotation by Swami Shivananda. He used to say that yogis, they measure their life by the number of breaths they take. This is what he meant. By taking charge of your breath, by decreasing the respiratory rate, by minimizing the, you know, your breath cycle, you can make it more efficient. You can harness more power from your breath if you learn how to decrease the respiratory rate. And third fact is, there are so many systems working in our body: digestive system, respiratory system, cardiac system, reproductive system, excretory system, nervous system, skeletal system. They are broadly either voluntary or involuntary. Voluntary means they are under your control, like skeletal system. Anytime I can walk, anytime I can jump, anytime I can move slowly. That is under my control. It's a voluntary system. Heart rate, not under my control. Digestive system, not under my control, or directly under your control. So they are involuntary system. Breathing, respiratory system, it's not under your control. But that is the only system in the human body which, though involuntary, can be made voluntary to the large extent. You can lengthen your inhalation, you can lengthen your exhalation, you can take charge of your breath cycle, you can take charge of your respiratory rate. And that is the master key which all our sages they have been using. That if we learn that art, then I can vouch you all will become healthy to a large extent. Of course, earlier you start working on this, better it is. So, how to decrease the respiratory rate? I will just give you two, three examples. Normally, we are respiratory rate of 14 to 16 per minute. Respiratory rate means breath cycles in a minute. One breath cycle is one inhalation, breathing in, plus one exhalation, breathing out. So one inhalation plus one exhalation is one breath cycle, and number of breath cycles you take in a minute, that decides, that is your respiratory rate. That is your respiratory rate. The moment your mind is affected, because of any reason, your respiratory rate goes high. The moment your physical body is affected, your respiratory rate goes up. So they decide basically your physical body and your mental body decides your respiratory rate. But best part is, and it's very difficult to catch hold of your body every time or catch hold of your mind every time. It's very easier to catch hold of your breath. It's the other way around also true. If you can decrease the respiratory rate, then you can decrease the number of thoughts crossing your mind. You can achieve clarity of your thoughts. You can achieve stress-free living. You can have a relaxed lifestyle. Similarly with the pain, just by taking deep breath, you can, it's a type of healing mechanism for the body. So breath and your sleep have a consultant, do I focus on breath? Breath is the best healing mechanism which has been given to us. So just by decreasing the respiratory rate, we can take charge of our physical body, we can take charge of our mental body. It's a beautiful bridge which connects the inner world with the external. And excel in both the worlds. It's not that external world is bad. No, we have to excel in the external world. We have to excel in the internal world. So for that, you have to learn the art of walking on this bridge. What is that bridge? Your breath. If you learn to walk on this bridge beautifully in an efficiently manner, then you make sure I can vouch again and again. I'm vouching. You can take charge of your mental health. You can take charge of your physical. They can be upgraded any moment, any time. What is to learn breathwork? There is no right. Any moment. It's something like, you enter a dark room. It's a beautiful story I have read. It's a beautiful, that has been dark for ages. The moment you light a candle or a matchbox, it lightens. So it doesn't matter for how long it has been dark. Just simply managing your breath, taking charge of your breath, you can enlighten. You can take your health to a different level. So today, what we plan to start is uh, it's an initiative of Venu Institute of Integrative and Lifestyle Medicine. So this is the first of the series which we plan to keep doing online. Every Monday we are going to meet. This month we are going to focus on the breathing part, breath walks. Importance of breath, any moment you can take charge of your breath. You take approximately 23,000 breaths in a day. So anytime you want to harness the power of breath, just focus on the breath. It is with you, available 24 into 7. You don't have to dependent on anyone else. So today we are going to touch upon an important aspect of all the pranayams also, all the breathing techniques also. That is known as diaphragmatic breathing. It is also known by the name of abdominal breathing, also known by the name of belly breathing. If you know how to manage the movement of your diaphragm at will, you should be able to move your diaphragm at will. Then you become an expert in breath work. And that is the basis of ancient yogic science of pranayama. This brings me to an interesting episode which happened with me once. A person came to me, he said, I have been practicing pranayama for ages now, but I don't find much difference in my health. So I asked him how he is doing that particular pranayama, very common pranayama, Anulom, Vilom or Nadi Shodhana. He showed me, and he was not using his diaphragm at all. Basis of all the pranayamic exercises, all the yogic techniques is diaphragmatic breathing. If you are not using your diaphragmatic breathing, if you are not using abdominal breathing, then you are not going to get much benefit from any of the ancient yogic techniques. So today we are going to focus on diaphragm. For that, I will take you to the anatomy, just simple anatomy. What is diaphragm? It's a very powerful muscle which chest cavity with from the abdominal cavity. Just see. I mean, this is the diaphragm. Take a second. This is the diaphragm. It's a dome shaped, just like an umbrella or just imagine it's a dome shape. It is in the front, it is in the side, it is at the back. So the diaphragm is like a dome. It's a tent shape. which divides the uh, cavity. Chest cavity, you know, it has got two important components: lungs, two lungs, and one heart. And then the abdominal cavity contains all the abdominal organs. You are well versed with those organs: intestines, stomach, liver, kidney, reproductive system, skeletal system, everything, that is part of the abdominal cavity. So what happens? This is the diaphragm. As soon as I start moving, start inhaling. So what happens? The diaphragm, which is normally the dome shape, it flattens, it contracts and flattens. When it flattens, what happens? It pushes the abdominal organs down, which in turn push the abdominal wall up. This is the diaphragm. Inhale, abdominal organs are pushed, the wall goes up. So effectively, what you are seeing is when you inhale, if you're losing your diaphragm, your inhalation means it goes up. Exhalation means this is the normal contracted diaphragm. So when the diaphragm, at the end of inhalation, the diaphragm starts relaxing. Means again will happen. The diaphragm they come back to their normal. The abdominal wall will come inside towards the back. So what happens? Basically, it goes out and then will exit. This is what you are going to see. If this is happening with you, then you are using your diaphragm. If this is not happening with you, then you have to make sure that you start using your diaphragm. Because diaphragmatic, we will see what is the importance of diaphragm, why we are focusing so much on diaphragm. You go to social media, they will keep telling you abdominal breathing, abdominal breathing, abdominal breathing, belly breathing, belly breathing. Why? What is the importance? Why is so much importance has been given to the diaphragmatic breathing? You will see various reasons why it is more efficient. But let's start with this. So, see, when I will show you maybe this will make things more clear. It's okay. Face is which this is where it's a tent shape. Okay. So when I inhale, this goes on, the tummy goes. So if I put my palm onto the navel area, so when I'm inhaling, the tummy goes out. When I'm exhaling, the tummy. Inhalation, exhalation. Tummy is going out because of the movement of the diaphragm. I'm not using this abdominal wall at all. Abdominal wall is going out because I know how to take charge. So if you can take charge of your diaphragm, then automatically this happens. See, see again I'm showing you inhalation, diaphragm goes down, tummy goes up. See, when I'm inhaling, inhalation, exhalation. This is how we are going to see inhalation, exhalation, inhalation, exhalation. Another confusion which a lot of people have got, that when we are doing abdominal breathing or diaphragmatic breathing, air doesn't go inside your stomach. No, air cannot go beyond your lungs. As simple as that. You have got two lungs. Whenever you are inhaling or exhaling, you are basically in the lungs and deflating. Inhalation, the lungs they become full of the air which you have inhaled. Exhalation, the lungs collapse, deflate. Lung is a structure which has got no muscles at all. It's just like an elastic tissue, just like a balloon. Inflammation, If you want to inflate the balloon, what happens? You put air inside the balloon. The balloon inflates. And you stop inflating the balloon, it deflates. Simply. Similarly, with the lungs, inhalation is active, exhalation is passive because of the elasticity of the lung tissue. And the reason why all of you should be doing breathing exercises because that gives longevity to the lung tissue. Lung tissue means elasticity. They become more elastic. Their volume increases. They become physiologically efficient. Here, I had a beautiful paper which says the more is your lung physiologically efficient, the more will be your lifespan. Just see the beauty of it. You need to work on your breathing exercise. Why? To maintain, to increase the elasticity, to increase the lung volume, to increase the efficiency, to make the lungs physiologically more efficient. That's the basic aim. So, and another interesting thing is this diaphragm is moving in all the directions in the front. If I put a hand on the navel area, when I inhale, the tummy goes out, exhale. If I put it below the rib cages, this is the rib cage. Yes. When I'm inhaling, see what happens. Inhalation, tummy goes out, goes in. This way, if you simply put your hands, you can make out whether you are using the diaphragm or not. Take a deep breath. If these palms go up, you are using your diaphragm. If they don't move, that means you are mainly using your chest wall muscles. You are a chest breather. So we will learn a simple technique to find out whether you are a chest breather or you are doing diaphragmatic. Let's sitting on the floor, sitting on the chair, everything. Be comfortable. Make yourself comfortable. And then once you sit down, gently close your eyes. Put one hand on the navel area, second hand on the chest. And simply close your eyes. And keep breathing normally. Whichever way you have been breathing, just keep breathing. After closing your eyes, focus on your chest and see the chest wall movement or the palm which is on the chest, how it is moving with your inhalation and exhalation. When you breathe in and out, how it is moving. After 5 breaths, then shift your focus to the second palm which is on navel area. See how it is moving with your inhalation and exhalation. Don't manipulate your breath. Whatever type of breathing you are doing, just doing that. Three things are possible. One, your chest wall movement is more than the abdominal wall. That is good. Second is your abdominal wall movement is more than the chest wall. That is also good. Third is your abdominal wall movement and chest wall movements are equal. You have been breathing like this for so many years without any problem. If the abdominal wall movement is more than the chest wall movement, that means you are using your diaphragm more efficiently. I'm not saying that you are using it, but more efficiently. If the chest wall movement is more, or it's almost chest wall movement, there is no abdominal wall movement, That means you are not using your diaphragm at all. To find out whether you are a chest breather, if you are a chest breather, then the chances are you're stressed, your lifestyle will be disordered, it will not be in a disciplined way. If you are an abdominal wall breather or diaphragmatic breathing or belly breathing, there are three names. You search on the Google, you can find out. In all three, we are using diaphragm. Why? What is the importance? Why is so much emphasis being given to the diaphragm? What's wrong? We have been living for last 40 years, 50 years, 60 years without any problem. Why this fellow suddenly come and saying that no diaphragmatic breathing, no abdominal breathing, do belly breathing? What is the importance? The nervous system which relaxes you, which leads to functioning of all the organs, your heart, your lung, every that part system, the main nerve of that nervous system passes through the diaphragm. So if you are moving your diaphragm, you are activating that nerve. You are activating that nervous system. You are taking charge of the nervous system. And when you are taking charge of the nervous system, what is nervous system? Nervous system is mother of all the systems in the body. Digestive system, reproductive system, excretory system. If you know how to take charge of your nervous system, and there is just one way of taking charge of your nervous system, by learning the art of diaphragmatic breathing. You will become healthy. Why? You will always start working optimally. Why? Because you have learned the art of activating that nerve, which the mainstay of the nervous system, which innervates all the organs, which makes sure that all the organs work optimally. The pancreas also. And that one of the reasons, because of this long breathing habits and long sleep, we are having all sorts of lifestyle disorders. It's a beautiful chapter. We will talk about that in detail some other time. So today we are the diaphragmatic breathing. So make sure you are doing diaphragmatic breathing. If you are doing diaphragmatic breathing, you are activating that part of the nervous system which relaxes you, which help your organs to work optimally. How to activate that? By learning the art of diaphragm moving. And you move the since I have been practicing, I think I have been practicing for last more than 30 years. So when initially what happens when you are aware of your breath, you will start doing diaphragmatic. Since you have become, you have that information now how to do diaphragmatic. But again, when you are unaware, because you cannot be aware of your breath all the 24 hours. You can be aware of your breath 15 minutes, 30 minutes, 1 hour, 1.5 hours. Consciously aware. Not because of some medical problem that you are aware of. If you can take charge of your breath, if you can add awareness to your breath for half an hour, 45 minutes, that time you will be doing diaphragmatic. But again, it will revert back to when you are unaware of your breath, it will revert back to chest breathing. That's perfectly enough. But slowly you will form the grooves where the body and mind they will help you in forming that groove. That which is the best way and why you need to do that breathing all the time. That is known as automatic state. So even when you are unaware of your breath, you are doing diaphragm. This is what we want to achieve. This is our mission. That make sure that the patient are in the breath and what breath? Diaphragm. Serene breath. Number of breath cycles? Less. Normally it is 14 to 16 we talk. If you can bring it lesser the number of breath cycles in a minute, the more efficient your breathing system. Emotionally disturbed. mentally stressed, not having good sleep, wanting people your one pointed and concentration, want to feel happy, joyous. Breath is the common thread. Just by doing diaphragmatic breathing, you can achieve all these things. So, my dear friend, my request is make sure that you are using your diaphragm, minimize the use movement of chest wall muscle, maximize the movement of abdominal muscles. They call it the diaphragm. Just imagine that your lungs are like balloon. As soon as you start inflating the balloon, what happens? The lower part starts inflating. This is that means you are using when the lower part of the lung starts inflating first, that means you are using diaphragm. So learn this art of doing diaphragm breathing. Tummy goes out, exhale, tummy goes in. Again, show you from the side so that you can appreciate it better. Exhale. This is the all the pranayams also. Nadi Sudhan pranayam, Sheetkali pranayam. If your foundation is not diaphragmatic breathing or abdominal breathing, then you will not get the benefit which should be given by those pranayam or breathing techniques. Make sure we will talk in detail about in future sessions. Any questions, any queries from your side? You are most welcome. You can type your question and request my team to help me out if we can answer a few questions. So, if there are no questions, two things are possible.
Ajay, you'll need to unmute yourself.
You type the questions if you want, or you can talk to me directly.
You're still muted, Ajay.
My teacher used to tell me that if there are no questions, two things are possible. Either everybody has understood all the things.
Can I speak? Can I speak?
Yes, Lakshmi ji.
Sir, it was wonderful to hear you. First of all, you set us right by saying that we are not even aware of the importance of a breath. We take it for granted. And this is a life lesson that we have to learn. Thank you so much. It was wonderful to listen to you. I have just one question which I need to ask you, because I have a heart condition. I went through a heart surgery. And there are moments, like for anybody in life, there are moments of great anxiety, great stress. At that moment, what should I do to calm myself? To be a little calm, to face that little crisis which may go away. But around that time, my breath comes too fast, and my cardiologist says you should not be breathing like that. So could you advise?
Interesting question. That is very common to all of us. Moments will come when you will be stressed. You can't help it because stress is not under your control. How you respond to that stress? That is under our control. So one very good thing is by working on exhalation. If you know how to lengthen, I plan to take this maybe in the next session. If you can focus on your exhalation, there is a beautiful paper in psychology in 2019 which says by lengthening your exhalation or breathing out time, You can hack into your nervous system. You can make it relaxed. You can become stressed. So just by lengthening, see, one easy way of lengthening your exhalation is take your breath through the nose and exhale through the mouth as if you are holding a straw. This is also known as straw breathing. This is one of the best technique of lengthening the exhalation. So just see. Basically, I am giving an obstruction to the outflow at the level of the lips.
Okay.
So that
Now you can
the
speak.
air is slowly exhaled. This
I
is
can
known as
speak now.
stress breathing. This is known as straw breathing or persistent breathing. So just by lengthening the exhalation, you can take charge of that situation. What this helps in by achieving the clarity of the mind, so that you can take the best decision or you do the best thing which is required at that time.
Thank you very much, sir. I think I'm going to try first, the very next moment, opportunity that I have, I'm going to try to do that because I would like to be restrained and controlled in accepting something as stressful and breathe properly. Thanks very much, sir. Very grateful.
Thank you. Thank you, friends. And this is going to be our regular session. Every Monday, we plan to start at 11 and finish it off by 11:45. And ask your friends, ask your relatives, those who can join us. We want to spread this. Our aim is to spread this message. It's such a simple treasure we all have. Just by using this power of this excellent, this is a divine which has been given to us. And take charge of our health. Thank you very much. And now hand over to Dr.
Can I just ask a question? I'm Nutan.
Yeah, sure.
Nutan Bhargav. I mean, it's more not a question, but a clarification. I also do pranayam, and rightly or wrongly, now I have understood a little bit, jaise aap keh rahe hain, that you should do diaphragm breathing. But what happens, just correct me, like I take a deep, say when I'm doing alom, left se liya, right se jab I take out the breath, can come out as smooth as what I my left nostril. Breathing is smooth. When I'm breathing out, it makes like so far. I have to do it. Is it that I'm not doing it or there's an obstruction? I mean, I don't.
Are doing it perfectly well. Honestly, the thing is, there are muscles which are involved in. So maybe your muscles which are involved in exhalation, they are a bit. Maybe your diaphragm is a bit weaker. So if you can strengthen your diaphragm, the muscles of exhalation, then to help you in lengthening your exhalation. Common.
Okay.
That can happen. Nothing to worry. Only thing you have to work on is the strength of your diaphragm, the strength of exhalation.
And I also would request and that, whenever we have the next session, just one or two pranayams up kare and follow. Every yogi and person who teaches yoga
Definitely.
knows it, but they teach us wrong. You see, I mean, so we want to be corrected more, and you're explaining it scientifically, which is very good. So thank you very much. Thank you. It was a lovely session. Thank you.
Most welcome. What we plan to touch is various commonly done pranayama exercises. We plan to touch those things also in future session. Thank you very much. I hand over mic to our CEO, Dr. Sagar sir. Thank you, sir.
नमस्कार डॉक्टर भट्ट, एक बहुत यूजफुल सेशन देने के लिए। एक्चुअली वेन्यू चैरिटेबल सोसाइटी पिछले 40 साल से ज़्यादा से लोगों की सेवा करने में, लोगों को लाभ पहुंचाने में लगी हुई है। और ये ब्रेथ वर्क जो है, ये हमारी इंस्टीट्यूट का एक नया इनिशिएटिव है। डॉक्टर भट्ट ने बहुत कोशिश करके इसको समझाने की कोशिश की है। श्वास क्रिया जो है हमारे शरीर में, और श्वास का बहुत बड़ा योगदान है। अगर हम अपने श्वास को कंट्रोल कर लेते हैं तो हम अपना ध्यान शरीर को समझत से बना सकते हैं, अपनी स्ट्रेस और एंजाइटी को खत्म कर सकते हैं, बेटर स्लीप इंट्रोड्यूस कर सकते हैं। और ये श्वास का बहुत बड़ा रोल है। और ये हमारा इनिशिएटिव हर हर हफ्ते मंडे के दिन होगा। और जो भी पार्टिसिपेंट्स इसमें, जो लोग भी इसमें पार्टिसिपेट करना चाहते हैं, वो अपनी रिक्वेस्ट जो है, वो अपना इंटेंशन जो है, जो अपना इच्छा जो है, वो अपने 9560286667, आई रिपीट 9560286667 पर रजिस्टर कर, और हम उनसे कांटेक्ट करेंगे और उनको बताएंगे। हमारा ये इनिशिएटिव जो है जारी रहेगा। और आपके योगदान के लिए, आपके पार्टिसिपेशन के लिए मैं एक दफा दोबारा से धन्यवाद करना चाहता हूं, और तहे दिल से। और ये क्रिया को आगे बढ़ाने के लिए आपका योगदान बहुत जरूरी है। अपने क्वेश्चन, अपने कंसर्न इस नंबर पे आप भेजिएगा, हम उसका रिप्लाई देंगे। और आपको अच्छा जीवन जीने के लिए, अपने श्वास को कंट्रोल करके जीने के लिए आपको बताएंगे। इसमें कोई लागत नहीं आती है। इसमें सिर्फ अपने आप को कंट्रोल करना है, और अपने श्वास को कंट्रोल करके ही हम सब जीवन अपना अच्छा सा बना सकते हैं। धन्यवाद, धन्यवाद।
Before we close, just a small announcement also. I am sitting on a regular basis at Venu Institute, and I am available for consultation also from 10 to 1 from Monday to Thursday. Thank you very much. Hoping to see you soon. See you for the next online session.
Thank you very much.